Welcome, everyone. I'm Sarah Wright with the Colorado Foundation for Universal Healthcare. So I wanted to let you know that we are intending to use your contributions as an important part of today's event, as well as to usher in healthcare for all that cares for us all. So please do share in the chat your name, where you live, and your vision in 50 words or less for what it will mean when we all enjoy quality healthcare and everyone can access and afford it. Bill Semple, the Colorado Foundation for Universal Healthcare's board chair, and Patricia Rice, our social media director, will select some of these chat contributions to read aloud today. And we'll publish most of them in the blog on our website. And we hope to harness your ideas in ways that help the country move forward to national universal health care. So we appreciate you being here. Thank you. And for those of you just arriving, we really want you to add your name and where you're from and what's your vision in 50 words or less for what it'll be like when we have healthcare for everyone. Thank you for being here. So now I'd like to introduce two of our board members, both who are powerful forces for good in our communities. Robert Davis, Doctor of Ministry and Masters of Divinity, through his nonprofit Unboxed, helps businesses and organizational leaders create workplaces with healthy relationships. And we at the foundation appreciate that, Robert, thank you. A community leader, Robert facilitated the work of the Community Task Force formed in the wake of George Floyd's murder that has released 112 recommendations for reimagining policing and public safety. And you can see those at denvertaskforce.org. And then Radhika Nath, with a PhD in public policy, has worked in healthcare locally, nationally, and internationally. She served as a Bernie 2020 campaign Colorado co-chair, serves as a member-elect of the Democratic National Committee, and works tirelessly as a disability rights activist and an advocate for healthcare as a human right. So before I share Radhika and Robert's screens with you, we did encourage folks to make submissions ahead of time along the theme. And this is a haiku, and it sort of starts with the nightmare that we're in now before we pivot to where we want to be. It's from Larry Kagan, MD, who is a member of the Medical Professionals Universal Healthcare Group. And Laird writes, symptoms hint sickness, a doctor not authorized. Heartbreaking tears flow. So I'm gonna see if I spotlight Radhika, if it will move my spotlight. And so I can find Robert. There you are, Robert. Okay. Spotlight Robert. We're going to spotlight Radhika. This is an envisioning exercise. So we're going to ask that you close your eyes or look down gently, whatever works for you. A picture, if you will.
Imagine healthcare that cares for you.
Imagine if you get sick or injured and you could focus on getting well without worrying about the cost.
Imagine if everyone you spoke with in the healthcare system was focused on your well-being, not on collecting money from you.
Imagine everyone around you having access to quality health care, including restaurant workers, essential workers, you, your family, and your friends.
Imagine if the business of healthcare was to provide the best quality care possible.
Imagine if the responsibility of the healthcare system was to care for you.
Imagine being able to start a business, care for children or elders, or focus on your creative pursuits without having to worry about losing health insurance.
Imagine getting the health care you need without having to lose your home.
Imagine you and your provider making healthcare decisions together based on what's best for you, free from insurance company meddling.
Imagine your doctors, nurses, and health aides receiving the support they need to provide you the best possible care.
Imagine us all as happy and healthy as possible.
Imagine your providers looking happy and healthy instead of stressed out and miserable.
Imagine us all with the freedom to live life well.
Imagine health care that cares for you.
Thank you, Robert and Radhika. I just want to remind everyone that when there's 100 people on a call and we're all focused on this together, there's power there. So thank you for participating. And now we'd like to appreciate our dedicated and dynamic co-hosts.
The Colorado Foundation for Universal Healthcare hosts this event alongside co-host partners working to win guaranteed quality healthcare for all for life, including our co-hosts Arvadans for Progressive Action, Colorado People's Party, Colorado Working Families Party, Democratic Socialists of America Boulder, Democratic Socialists of America Denver, Democratic Socialists of America Fort Collins, Healthcare Now, Healthcare for All Colorado, Healthcare for All Washington, and Healthcare for All Fremont County.
Robert, your sound is
Muted.
If you mute yourself, you may not be on mute. I'm sorry.
Okay, yes, it would allow me to unmute. Yes, our partners are as well Our Revolution Metro Denver, Public Citizens Medicare for All Resolutions Team, Physicians for a National Health Program, Physicians for a National Health Program Colorado Chapter, Physicians for a National Health Program Vermont Chapter, Rocky Mountain Peace and Justice Center, Single Payer Action Network Ohio, Whole Washington, Young People's Campaign for Universal Health Care.
Thank you so much to these co-hosts for all the work they do and for being willing to participate with us today. And now, next, Bill and Patricia are going to share from the chat some of the selections of, well, I think you have to turn your video on for me to spotlight you.
Having trouble with my screen. It seems to be freezing up some, so it's not letting me share video. I don't know why.
Well, I can do this with you, Patricia, but to warn everyone, I haven't had a chance to be looking at the chat.
I've been looking. So
Okay, Patricia, go for it.
I have one that it's from Brandon Kidd Barrett. I will finally be able to get some surgery that I've been putting off for over a decade. Another one, health care for all equals a sense of community and happiness, from Eileen Manya. Angelica, Colorado, people with disabilities will be treated with care and dignity.
Patricia, maybe you should just keep going.
Okay, well, I haven't written them all down. Healthcare is a human right, end of story, from Seth Weinberger. Fantastic, Seth, I love that. Madeline Jacobs, all humans will be able to access healthcare without bankruptcy and home loss from cradle to grave. And that's what I've written down so far. So,
Okay. So
but there are 34 new messages, so we've got
we're
long
thrilled.
to go.
I see from Elaine Branyard, I imagine I will feel as the journalist and author Anand Giridharadas described when he received health care in London. Receiving care in the US will be like being hugged by 331 million people. Mary Pat DeWald writes from Evergreen, Colorado. Imagine universal healthcare with optimal health and wellness for you and all individuals, families, and communities. Imagine. Dave Anderson from Boulder, Colorado writes, a society with economic security is taken for granted. And you don't have to worry that if you get sick, you will be taken care of and not have your life destroyed at the very least. All right, well, we're going to stop with those for right this second, knowing that we intend to publish these all together in a blog. And we hope that various members of the movement can use these imagining statements in graphics and social media and in other ways. So thank you, Patricia. I'll stop, move your spotlight, and I am going to now share my screen with another contribution that comes to us from Luke Whitcomb in Fort Collins.
Hi everyone, my name is Luke. I'm a graduate student at Colorado State University studying biomedical science, and I imagine a United States where the wealth of an individual does not primarily dictate the number and quality of their years. I imagine a world where each individual, regardless of socioeconomic status, is able to access preventative health and medical services, and that these goods are treated as a public good. I believe that a solution to our current healthcare system lies in dramatically reorienting its financial incentives to favor measures of human thriving rather than the number and complexity of illnesses treated. This sort of approach will demand collaboration between members of the medical community and business professionals dedicated to human-centered and socially responsible approaches to healthcare systems. I hope by the time that I'm a doctor, I can enter into such a system or otherwise work to help make it a reality.
Well, thank you to Luke. And Robert, I'm going to spotlight you and ask that you introduce our keynote speaker.
Before I do that, as Sarah shared, for the past year, I have been leading the Denver Task Force to Reimagine Policing and Public Safety. Our work has discovered the strong intersectionality of healthcare and public safety reform. To that end, I am honored to introduce our speaker, Mr. Michael Lighty. Michael Lighty has organized, advocated, and developed policy for improved Medicare for all nationally and in California for the past 29 years. He served as Healthcare Constituency Director for Bernie 2020 and is president of Healthy California Now, the single-payer coalition of organizations representing 6 million Californians. He served as Director of Public Policy for National Nurses United from 1994 to 2018 and as National Director of Democratic Socialists of America in the 90s. He's on the board of directors of People's Action, Progressive Democrats of America, and the Martin Luther King Jr. Freedom Center in Oakland, California, where he lives with his husband, Jay. You can follow him on Twitter at mlighty60. With snaps and claps, please help me to welcome Mr. Michael Lighty.
Thank you so much, Robert Davis, for that kind introduction. It's an honor to be with you and Radhika Nath and Stephany Rose and the co-hosts and all the advocates for universal healthcare here as we take on the profound opportunity and challenge to imagine a healthcare system that cares for us. When we imagine healthcare that cares for us, we envision a different value system that would animate our society. Instead of a narrow, possessive individualism that puts property first and relies on a limited version of responsibility, which in healthcare translates into on your own healthcare and receiving only the healthcare we can afford, we instead would take responsibility for ourselves and each other. We would put humanity first based upon the values of solidarity, justice, and freedom. Solidarity comes from security and trust. Knowing we will get the health care that we need overcomes the resentments created by insecurity, the feeling that someone else is getting better health care, getting more assistance with their healthcare needs. We've seen how guaranteeing healthcare for all builds upon a sense of social solidarity and creates it. Existing examples include the cross-partisan support for Canadian Medicare and the national health system in the UK. Justice flows from a society based on equity, and there is no greater denial of our humanity, nothing more inhumane, as Dr. Martin Luther King Jr. said, than injustice in healthcare. Justice is righteous. Justice is fairness. We imagine a just healthcare system as one that provides care based on need, not profit, that enacts kindness in the everyday interactions of caregiving. Freedom is the ability to live fulfilling lives with the resources to make the decisions that determine our destinies. And without our health, how can we be free? Acting on these touchstones of solidarity, justice, and freedom would create a healthcare system that promotes health and well-being, in which healthcare is not an industry, but a public good, that shifts caregiving from the medical model of disease treatment to the public health model of disease prevention. Kindness, caring, and compassion would guide our healthcare interactions. We call it guaranteed healthcare, and it is so much more. We imagine a healthcare system that cares for us in the context of today's triple crises, which are public health crises that create post-traumatic stress, illness, and mortality. I'm speaking of the crisis of economic and social inequality, the crisis of the impact of state-sanctioned violence, and the crisis represented by the devastation of the COVID pandemic. These crises raise the question of what keeps us safe. For example, since policing does a poor job of preventing crime and looks to punish after the fact, prevention in the form of expanded mental health services, economic security, and quality housing would be most effective to create a safer community. In looking at this topic, I found a recent multi-stakeholder dialogue for the Southeast Asian and Western Pacific region, hosted by the Non-Communicable Disease Alliance, titled Inspiring Change, Putting People First, which focused on expanding public health programs as the basis for imagining a world where no one was suffering from preventable disease, be it non-communicable diseases or infectious diseases, or had to die untimely deaths due to diseases that were primarily avoidable. This, in their view, would be a tobacco-free world, and in our view, a world where healthy, balanced nutrition for all was a reality, where health for all was not just a chant, but a reality for everyone, where no one was truly left behind. Just because we must imagine such a world doesn't mean it's far off. If governments had been on track on all promises made in the 2015 UN General Sustainable Development Goals, we would have been much better prepared to deal with the current public health emergency, and even better prepared to deal with and better prepared if governments had been on track to ensuring rights-based access for each of us worldwide to a full package of standard prevention, diagnosis, treatment care, and support. Simply put, a humanity-first healthcare system saves lives. That's a world we can imagine and create. To create it means profiting from illness must end. COVID and the COVID pandemic has revealed the necessity of a different healthcare system. Black and brown communities have been disproportionately affected by COVID. Most people who have died and suffered severe illness from the coronavirus did not have access to basic health services, such as diabetes prevention and therapy, hypertension prevention and therapy. And these folks may still not have access. Also, failure to fully implement life-saving tobacco control policies have made us more vulnerable in this public health crisis. These are elements that we must incorporate in our imagined healthcare system that cares for us. As reported by Shaba Shukla of the Citizen News Service and others, the countries that have done better in dealing with the pandemic are those that have invested in the basic primary health care and Social Security, community-led health responses, and much better distributed public health infrastructure. Our imagination of healthcare that cares for us is also feminist. We envision a feminist fossil fuel future based on solidarity and caring. A feminist health system is one in which socially just and ecologically sustainable for everyone everywhere, so that we can genuinely deliver on the long overdue promise of health for all, where no one is left behind. That is at the heart of our vision. We know women are the primary caregivers in families, yet worldwide little attention is paid in many places to their own health. So many of them get medical care, if at all, at a very late stage, which has proven disastrous. We should not forget that disease is the problem, not the people. That's at the heart of our imagined healthcare system. Let's make people a part of the solution to deal with disease. That's our vision, a people-centric feminist approach to improve our behavior toward health seeking, as well as access to prevention, treatment, and care. All that is key. Let's stay united in our fight for a healthier world. Together we can. In California, a group of advocates has come together to design legislation that creates a lifetime caregiving system branded as CalCHA, which I draw from here. Such a system starts from the premise that healthcare is a public good, not a commercial commodity, and that provides a high quality standard of safe, therapeutic, and effective care. This approach to lifetime care includes preventive, primary, and specialty healthcare, training and research. It includes the delivery of medical, mental, psychological, sensory, surgical, nursing, rehabilitation, and habilitation, public health, dental, pharmaceutical, and home and community-based care. This is comprehensive care. The objective of lifetime care is to assure that all people experience freedom from fear and achieve a state of physical, mental, and social well-being, not merely the absence of disease or infirmity. This is a fundamental right of every person. We imagine that enjoyment of this highest attainable standard and its equitable distribution, allocation, and achievement of health, safety, happiness, and privacy must exist for every person without distinction of race, religion, gender identity, or sexual orientation, disability, political belief, economic or social condition. In this, government has an affirmative duty as a guarantor of equity. As we imagine a humanity-first healthcare system, we recognize that the health of all people is fundamental to the attainment of maximum economic autonomy, cultural productivity and expression, peace and security. This is not a top-down system, but rather it is community-based, in which the provision of care is dependent on democratic participation and coordination for individuals, neighborhoods, municipalities, counties, regional agencies, and the health workforce, including receiving a living wage. Freedom in this system comes from the elimination of financial burdens of any kind. There would be no cost barriers to obtaining any necessary healthcare, ending all individual and family out-of-pocket costs, fees, copays, deductibles, and insurance premiums, other than those paid through public financing, which is itself a characteristic of healthcare as a public good. At its most basic, it would mean going to a doctor's office, showing a health security card without checking insurance or making a copayment, having time with our provider to address our individual conditions, and leaving with prescriptions and a treatment plan based on what we need, not what our insurance will cover. In a humanity-first healthcare system, economic prosperity and major savings will result from cost-effective and prudent reductions of existing medical system costs. eliminating marketplace intermediaries that expropriate funds from care and systemic waste, price gouging, fraud, and inefficiencies. This will free industries from the relentless cost escalation and spiraling burden of providing private medical coverage for employees. Our system of guaranteed healthcare will stimulate an entrepreneurial expansion among individuals, free from the fetters of employment-dependent healthcare and ending job lock. We imagine and seek to create informed opinion and active, small d, democratic participatory cooperation, familiarity, and trust on the part of the public to make the decisions that govern a healthcare system that cares for us. This is an example of making the decisions that determine our destinies. Specifically, we would all engage to the best of our ability in the planning, delivery, distribution, monitoring, evaluation, safeguarding, and improvement of the individual and community health. That's what responsibility would mean. Our imagined healthcare system includes budgets for lifetime care services designed to decentralize and deinstitutionalize the service delivery system to maximize the comprehensiveness of home, family, individual, and neighborhood healthcare. Our newly imagined health promotion system fosters personal autonomy, including easy access to neighborhood health centers, fully funded and staffed community clinics within reasonable distances to where the residents reside. We imagine a better healthcare system that is part of a comprehensive housing plan and system that will establish a home guarantee for all and ensure that no person discharged from a mental health or hospital setting will be rendered homeless or placed in a dangerous or unsanitary living condition, as is so prevalent now. To significantly expand and strengthen the physical, mental, dental, and social health of youth from preschool through graduate school, we would a preventive and wellness system would partner with the education system to cover all prevention, screening, and early interventions with follow-up to maximize robust wellness and nurture emotional security. As for all, food security would be guaranteed. Learning would occur in an ideal academic, physical, psychological, social, and cultural environment, because all of this is connected. Lastly, we imagine our healthcare system can face the existential crisis of climate change and its associated impacts for life on Earth. As I said, this is a profound public health crisis. A just and responsive healthcare system must be prepared to address grave and vast health consequences from fire, flood, desertification, land submersion, biological pandemics, food, air, and water pollution. The transformation to guaranteed healthcare must both prepare for such impacts and provide for care that is carbon use in all its energy and structural developments. Yes, this is a profound challenge and opportunity. Yes, we can imagine the solidarity, justice, and freedom created by guaranteed healthcare. We know how health equity changes the balance of power in society. Let us dedicate ourselves now to achieving health justice. Thank you so much.
Wow, thank you, Michael. That was amazing. As we learned, as we began to organize this event, it's harder than you would think to go from where we are and pivot to where we want to be. Our first attempts all involved, not this anymore, not that anymore. And you really went there, and you went there in a really big way, and we are so thankful. I can't wait to rewatch what you just said. So thank you again. And really appreciate this is being recorded, so this will be available soon and on Facebook. So Robert Davis, will you please go ahead and introduce the next person who's a force of good on our lineup?
Hello again, and allow me to introduce a very powerful woman, Stephany Rose Spaulding. Reverend Dr. Stephany Rose Spaulding is an activist and public commentator who has served as pastor of Ebenezer Baptist Church in Colorado Springs, as Associate Vice Chancellor of Equity, Diversity, and Inclusion at University of Colorado, Colorado Springs, and a professor of Women's and Ethnic Studies at University of Colorado, Colorado Springs, as well as on the board of the Colorado Foundation for Universal Healthcare. Reverend Dr. Rose Spaulding is the author of Recovering from Racism, a guidebook to beginning conversations, published in 2015, and Abolishing White Masculinity from Mark Twain to Hip Hop, Crisis in Whiteness, published 2014. A creative and vocal being, she's a founder, leader of Truth and Conciliation, a nonprofit dedicated to dismantling systemic racism and all forms of oppression in order to build an inclusive, diverse, and equitable future for all our relations. Be prepared to be inspired as we welcome the Reverend Dr. Stephany Rose Spaulding.
Good afternoon, everyone. Thank you, Robert, for that phenomenal introduction. And thank you all for allowing me the opportunity to even share, to imagine with you a healthcare that is rooted and grounded, as Michael pointed out, in justice, in liberation, in equity for everyone. As an African-American woman, I imagine healthcare that is centered in a value system that uplifts our full humanity, our complete wellness, and dismantles systems that privilege and oppress some. I imagine a healthcare system where Black women don't die at exponential rates in childbirth. I imagine a healthcare system where communities of color have the faith and the trust in medicine so that they are actually visiting and having relationships with their healthcare providers. I imagine a healthcare system where my father is not leaving the hospital or leaving his healthcare provider with an entire pharmacy of medicine because he has and others have been given a way to make sure that we are well and not codependent on pharmaceuticals. I imagine a healthcare system in which Indian communities, our indigenous communities, are not being forced and sterilized in genocidal ways. I imagine a healthcare system that is not rooted and grounded in racism and classism. And these imaginations are not far off from any of us. As we have shared and said over and over again, when we take money and property and value and commodification out of the way in which we structure healthcare, and we are concerned about the humanity, about the lives, about the full wellness and the being of one another, then we can have a healthcare system that ensures everyone has access to the things that make them well. We are on the precipice of this work as we look to those who are doing this fight, who are carrying this fight forward, individuals like Representative Cori Bush and others who are advocating for the decriminalization of all drug use, for those who are looking to make sure that pharmaceuticals are not at the helm of our election processes. This is the way that we get to not just simply imagining what our healthcare system could be, but manifesting. And so as we move to beyond this convening today, we must move beyond just our imagination to putting our hand to plow, to making sure, as the Colorado Foundation for Universal Healthcare is doing along with its partners, that we are manifesting what we know is possible for all of our communities across Colorado and across this nation. It is within our grasp and it is within our lifetime that these imaginations can come vast realities, really quickly and soon. And so again, I thank you for allowing me to imagine with you, but I also encourage you to not just imagine, but to support this organization as well as our partner organizations in doing this work, because we will manifest what we believe and hold true to make sure that there is no generation that comes behind us that is tied to money as opposed to wellness. Thank you. And again, let our imaginations become manifestations of what is possible.
Yes, ma'am. Thank you so much, Stephany, for inspiring us all. And you're right, everyone on this call is part of a ton of work. And we hope that this event fills you up and inspires you, because we do tend to get so caught up on the obstacles to what we want. This entire event is to inspire us for the next wave of action, and there'll be more on that later. I did want to share another contribution, so thank you again, Stephany and Michael. Robin Mills is a family nurse practitioner and registered nurse, and she writes her vision as follows: as a primary care provider, I see universal health care for all as improving social justice for all. I'd have more time to care for patients directly instead of via an insurance company. The health of our community would improve by guaranteeing access to preventative services, medications, and necessary treatments. We all do better when we are all feeling better. Thank you, Robin, for that. Just quickly, I'm going to share my screen to share a couple of graphics. Thank you, Luke, for your words. So this is a slide from our partners, Arvadans for Aggressive Action, designed by Leland Hoover. And I'm sharing it because Leland designed this Venn diagram to show that in these different areas that Arvadans for Progressive Action works, anti-war education, affordable housing, human rights, environment, these are their chosen action areas. The healthcare is at the center really of all of them. And it speaks to the fact that healthcare justice is in a way at the heart of all the social justice movements, and will impact the criminal justice system, our economic justice, racial justice, and environmental justice. And then I also wanted to share this slide to really recap what both Michael and Stephany were talking about. It's by Tim Akamura, who's an artist, and he wrote a story and shared his paintings in Washington Post magazine on June 2nd in a series called Painting Bravery. And this one is based on a selfie by nurse Laura Mansfield, who's head of nursing at NYU Langone. And it just shows the work together that these nurses were doing, the bravery they had to have every day fighting to save lives, these nurses and doctors, and fighting at the same time for racial justice in the wake of the straw camel situation that was the George Floyd murder. That was just the latest in a series of murders by state-sanctioned violence. And at the same time that COVID, we know, greatly impacted Black, Indigenous people of color more for a couple reasons. And one is our healthcare system that is unjust, and more people of color, BIPOC people, are uninsured and underinsured. And then there's also actual racism in the healthcare system, which the American Medical Association is finally doing some work to alleviate. I'm going to stop sharing my screen. Robert, I'm going to get you up on the spot to introduce our next speaker, whose last name rhymes with introduce, which is no cheesy joke of that.
Thank you again. In 2018, U.S. Representative Joe Neguse became the first African American member of the Congress in Colorado's history, representing District 2. He's serving his second term in office as member of the House Democrat leadership team, the Congressional Progressive Caucus, and as vice chair of the Medicare for All caucus in the House. Previously, Representative Neguse served as the executive director of Colorado's Consumer Protection Agency and as CU Regent and co-founder of New Era Colorado. He received his Bachelor's of Science from Colorado University, graduating summa cum laude, and received his Doctor of Jurisprudence from the University of Colorado's School of Law. Representative Neguse's parents immigrated to the United States from Eritrea, a country in Northeast Africa. Their experience motivated Representative Neguse to be an active participant in our democracy at an early age and to give back through public service. Representative Neguse and his wife, Andrea, and daughter, Natalie, live in Lafayette, Colorado. Please direct your attention to a powerful video by the Honorable Representative Joe Neguse.
I have the honor and the privilege of representing Colorado's 2nd Congressional District in the United States Congress. I want to say thank you to the Colorado Foundation for Universal Healthcare for inviting me to speak at today's event. I'm sorry I couldn't be there in person or live with you today on the Zoom, but nonetheless, so grateful for the opportunity to share a few words. Over the past few years, the need for universal healthcare coverage has become all the more pronounced, as countless Americans have experienced unemployment, unexpected illness amidst incredibly challenging economic circumstances. It's clear that the time is now to change the way our healthcare insurance coverage works. No American, in my view, should go bankrupt paying for the medical care that they need. No one should have to make difficult decisions, paying rent, putting food on the table, or paying for a needed prescription or care. And yet, far too many Americans are making those exact types of decisions each and every day. As the vice chair of the Medicare for All caucus, I was proud to join Congresswoman Pramila Jayapal and over 100 of my Democratic colleagues in unveiling the Medicare for All Act of 2021. The Medicare for All Act improves and expands the overwhelmingly successful and popular Medicare program so that every citizen of the United States has guaranteed access to healthcare with comprehensive benefits. These benefits would be greatly improved from the existing traditional Medicare, adding dental, vision, prescription drugs, long-term services, and more. It would require no out-of-pocket costs for patients for any services, and it would simplify the health system, cut down on administrative costs. As we work to build the needed momentum for Medicare for All, I also led an effort with my colleague, Representative Jayapal, as well as Representatives Lamb and Golden, recently to expand Medicare coverage in President Biden's family plan. Our request was to lower the Medicare eligibility age, expand benefits, set an out-of-pocket cap, and empower Medicare once and for all to negotiate drug prices to pay for that expansion. Access to quality healthcare coverage is critical. I continue to work to lower healthcare costs for our communities, to lower the costs of prescription drugs, and to ensure that everyone can access the care that they need. And I am so grateful to partner with each and every one of you in that effort. So again, thank you so much for hosting today's important event and for including me in the conversation. Thank you for your incredibly important work to make universal healthcare a reality. Stay safe, stay healthy, and stay hopeful.
Thank you, everyone. Thank you to Joe Neguse. Robert, I'm trying to figure out how to move your spotlight, but I like you sitting there next to me looking very formal. Let's see if I can get you. All right, well, thank you so much to our amazing speakers and again to our co-hosts and to each of you for submitting your visions, which again, we will publish and find ways to harness. And thanks to Representative Neguse for really being a champion for universal healthcare improvement for all. So we at the Colorado Foundation for Universal Healthcare are a grassroots, volunteer-driven group working toward a nonprofit, single-payer healthcare system such as improved Medicare for all, both at our our national level and for our state. Donate to the foundation today to help make this dream a reality. If everyone on today's event were to give $2, $3, $5, $10, $25 a month, it would sustain our work until we achieve universal health care for Colorado and the US. It would help us hire a volunteer coordinator so we can grow the Colorado movement to both win, well, we won't need both, but we'll take whichever comes first, to win universal health care in Colorado and to be stronger advocates for the national movement. So please donate today if you can. Please make it monthly if you can at couniversalhealth.org, which will be in the chat, hopefully, if one of my helpers helps me. And we also have a really exciting announcement. So on the call today is a music teacher from Denver named Marissa Russo, who bravely, when she saw there was going to be a grassroots national march on July 24th for Medicare for All, raised her hand and said, "Oh, sure, I'll organize Denver. What's that compared to like a classroom?" So Marissa, thank you. She's also a great singer. So we hope to get her on a future event in various ways. So the Denver March, 10 a.m., West Capitol Steps, Saturday, July 24th. We hope that you'll be there, that you'll help us get the word out. Super exciting. It's a chance to physically stand for what we're working toward, and there will be marches in Salida and Arvada as well. So we're gonna put those two links, both to donate to the Colorado Foundation for Universal Healthcare and a link to the march. You can choose the march that you want to be in. We know we have people from all across the country and they're marching in various cities. You can choose the one you want to march in, and it'll help the organizers have your contact information and involve you. So we'll do that as well. And then I was going to have Bill do the next part, but I'm not sure if his video is working.
My video is not working, so you can't see my handsome face, but if you can hear my voice, I'll say a few things about upcoming events.
Okay.
Because today's event is the first in a series of virtual events in our Imagine Healthcare That Cares for You series. Next, we'll build on a state of Colorado funded analysis that's been done by the Colorado School of Public Health that documents that we can cover every Colorado resident, have better health care, and spend less than we are now, but only with a single publicly funded, privately delivered way to pay for the healthcare in our state. So we'll use this objective data in our next event to inform and fuel the grassroots efforts to demand affordable healthcare for us all. We'll keep you informed about the next event as soon as the full report is made public. So stay tuned and thank you.
Thank you, Bill. Okay, we now have a video to share with you from the Young People's Campaign for Universal Healthcare. And this was designed by Ezra Halstad, one of our volunteers, and that's a growing group of volunteers. So without further ado. Okay, so universal healthcare is more possible now than ever, despite what it looks like.
Hi, this is Dr. Schiller. The movement.
My apologies. And it will empower us all to live our best life to the fullest. So I'd now like to introduce Jim Potter, who is our Legislative Action Coordinator. He's a retired civil rights attorney and has multiple talents, as you will now hear, and I'm asking you.
Okay, can you hear me?
Yes.
Okay. All right, well, I have a poem to read. It's called The Nightmare and the Dream. In the nightmare I had last night, when there was a pause in the din of ambulance sirens, I pressed my face against the pillow. My breathing stopped, gasping for air. In a panic, do I have to call for help? Must I take the long ride, quizzed upon arrival by the ER clerk about insurance, my deductible and copay, the wallet biopsy preceding treatment? I awoke with a start as if jolted by defibrillator paddles, now conscious of the new moment, feeling weightless and free, not tethered and bound to the past, for we have now settled that question, learning from Taiwan, Peru, Canada, the UK, and many others, as we join them in the light of universal humanity and healthcare for all.
Terrific. Thank you, Jim. So I have one more thing. That was amazing. I have one more thing to share with you that is a contribution that came in from Ira Denver. And so after that, if people would like to share, just raise your hand, and we'll do that after we stop the official event recording and let the people go that need to go, since it's been an hour. But if you have something you'd like to share, just raise your hand and we'll unmute you after we finish this last contribution from Ira.
Medicare for All Means Freedom by Ira Denver. Every one of us should be hounding Congress every day to demand single-payer universal health care, Medicare for all. The reason's simple. In a word, freedom. Freedom from financial woes caused by medical bills crushing millions of American families. Freedom to choose doctors without artificial provider networks shackling our choices. Freedom to change jobs with full health coverage as a human right and not at an employer's whim. Freedom to earn your living without missing work because of untreated health issues. Freedom for you and the children you love to enjoy the best of life. No more skimping on prescriptions and skipping doctor's visits because they're unaffordable, even with insurance. Freedom to get chronic conditions handled completely with no questions asked. Diabetes, asthma, you name it, so they don't worsen from lack of care. Freedom to get eyeglasses, hearing aids, cavities filled, and other health needs met. No out-of-pocket costs. Freedom from paperwork and mind-numbing complexity. No more navigating all the gotchas and fine print. Freedom from gut-wrenching uncertainty. Will this cost be covered? Will that one? If it's needed care, it's covered. You show a card, get treated, go home. Simple. This is what freedom looks like in wealthy nations around the world, except in the US. Now close your eyes. Take a deep breath. Let it out slow. Imagine what life will be like when all this comes true for you and your family. The weight off your shoulders, the exuberant feeling, an exhilarating sense of real freedom at last. This is what freedom will look and feel like under single-payer Medicare for all once we demand that Congress members stop depriving us of our freedom. Call your Congress member today. Stand up at the next town hall. Do it again and again. Don't stop till your Congress member co-sponsors single-payer universal health care, Medicare for all. Freedom will be ours, but only if we demand it. As Frederick Douglass said, power concedes nothing without a demand. It never did, and it never will.